Good evening. My name is Frederick Timbrook, and tonight we will be discussing childhood obesity, an American epidemic. Childhood obesity has become more prevalent in today's society than ever in the past. Therefore, it requires more attention. Kulesa, one of the former presidents of the National Association of Orthopedic Nurses, once said that 1/3 of all the United States children are obese. In addition, Van Grauwen-Volp also said that the prevalence of metabolic syndrome among children who are obese is at an all-time high. However, there are ways in which to counteract that. Exercise and a restricted diet are namely the two that we most focus on. First are healthy choices in behavioral management. Healthy choices in behavioral management promote a healthy lifestyle. In addition, exercise and diet promotes a lean body mass and also does not promote or is negative against adiposity, which is the development of adipose tissue. While there are many negative consequences that come about with childhood obesity, activity and diet counteract any negativity that comes along with early childhood negative health. Today we will investigate the consequences of childhood obesity, parental influences and how they influence childhood obesity and lifestyle choices, and also we will then investigate exercise and diet as positive influences on how to negate negative consequences of childhood obesity. Children ages 6 to 11, there has been a doubling of childhood obesity since 1980. However, since 1980, it has almost tripled among adolescents. Over 8.6 children who are diagnosed with childhood obesity have also been diagnosed with metabolic syndrome. Metabolic syndrome is a key diagnostic factor in determining cardiovascular disease and is also an indicator of possible type 2 diabetes complications, hypertension, which is high blood pressure, and also central adiposity, which is development of adipose tissue or fat around the abdomen. Parents also have influence. It has been said that often parents underestimate their children's lack of health. There is a positive correlation between a high parental BMI, which is the body mass index. The higher is worse and the lower is better. There has been a positive correlation between a high parental BMI and an underestimation of childhood activity level and nutritional value. In addition, there has been shown that parents who have a higher concern for childhood health also show a restricted amount of TV time and also give more concern towards healthy lifestyles, including physical activity and nutritional choices. Since childhood obesity is a multifaceted issue, it can seem kind of daunting. However, there are two very important lifestyle choices that can be added into daily routine that benefit the person, namely exercise and a restricted diet. In the case of nutrition and a restricted diet, when a medical professional intervenes, it must be personalized to the individual because of many socioeconomic factors that play into the role of developing childhood obesity. In addition, it has been recommended that a food journal be kept by children who struggle with obesity because they might not realize all the negative food that they intake and which causes their current medical condition. In addition, the recommendations for physical activity and also the restriction of sedentary time, which is in time in front of the TV, they do recommend that the averages for children from ages 9 to 15 exercise at least 60 to 90 minutes a day at moderate activity level or moderate intensity. And also, sedentary time should be limited to 0 to 2 hours a day. With those two factors in play, it is said that children promote the best quality of physical life. Also mentioned is that children must have support through this process. Parents must support their children. In addition, some parents who also struggle with obesity oftentimes sabotage medical intervention. To conclude this speech, the things to remember are that childhood obesity is a medical epidemic. There has been a steady increase since 1980 and is predicted to further increase later on. Of course, many of the consequences of childhood obesity include higher health risks later in adult life. Diet and exercise are key components in preventing and also battling childhood obesity. Parents play critical roles in support and understanding in their child's health status, and simple changes improve the quality of life. for a child who struggles with obesity. With the rising rates of childhood obesity, it is the duty of our generation to promote better health choices and also to sustain better quality of life. If we do not take the action in preventing further degeneration of children that struggle with obesity, we will not see a better future. However, if we do take it upon ourselves to promote healthy lifestyle choices, including diet and exercise, we can foster a healthier and better future for tomorrow. Thank you for your time.